on, let me go to the definition on what is acid reflux and what about it, and what is heartburn, and what is this GERD all about. Okay, so now number one, about this acid reflux, you can think it this way. It is your stomach gastric juice, okay, that actually flow back to our food pipe. Sometimes we call it the food pipe, okay, which is our esophagus, okay, which actually esophagus, and then it actually flow back. So it is the gastric juice, okay, our stomach juice, so actually stay in the stomach, but then it somehow it flows back, and then when it happens, then you will feel a burning, okay, you will, oh hi, from Philippines. Then when this, acid juice, the stomach juice, which is very acidic, the stomach juice can actually dissolve, okay, entirely dissolve, even the razor blade. It can dissolve a piece of zinc. It can dissolve even the aluminum foil. So if we have the acid reflux, meaning the stomach juice, which is very acidic, that actually flows back to our food pipe, or we call it the esophagus. It actually comes back. So you will feel that it is a burning sensation, it's a pain there because it flows back. So this is what we call acid reflux. So the acid that is supposed to be in the stomach actually comes back to you, okay? So usually when we eat something, okay, the food, we put into our mouth, and then it goes through the esophagus and down to the stomach. So it is shut down. There's a valve, okay, in between the esophagus or the food pipe, okay, and the stomach. So there's a valve. It's like a door. It acts like a door. So when the food goes in, the door won't open to allow the food to flow out. That's why whenever we eat something, the food won't flow out of our mouth again, or you will call it vomit, right? So it won't just flow out like this. So there's a valve that actually close up the entrance. And then so basically this is how the body works. The problem is when the valve is not working, or would say the door is not working, then the food, okay, the gastric juice can actually flow back into the esophagus, and then you can feel the sensation. It could be a burning sensation at the chest area. So that is where we have the heartburn, okay? The heartburn is a form of very uncomfortable indigestion, and then there's a burning sensation, okay, at the chest and at your upper abdomen. Yeah, that is where the gastric juice actually comes back. The stomach juice, it actually flows backward and then comes back to the esophagus, and that is why you feel the sensation there. So whoever that experienced this, usually they will think that it feels like a heart attack, okay? They feel like something pulling, there's a pain there. So this is what we call the heartburn. Imagine the acidic juice, okay, our stomach juice is very acidic. It can, like I said earlier, it can actually dissolve, okay, even the zinc and the aluminum foil. So it is going to hurt the esophagus. It is going to hurt our heart as well. That's why you feel the sensation there. You feel there's a pain there because it is so acidic. It is actually eating up your own heart in a way. So you will feel the pain. So for prolonged time, yeah, if you keep on having this kind of reaction, well, sometimes we have acid reflux, okay? Maybe once in a while, not too serious, okay? So you burp something sour, okay? That is what we call the acid reflux. But that is, this thing doesn't happen very often. So it is still okay, because our body has got this healing power. So we have got the self-healing, even though we have got some stomach juice that that comes out. We can, it hurt our esophagus, However, there's a repair going on, so it's not too bad. But if this problem prolong, okay, and it become chronic, it always happen to you. Like for example, in a week's time, you're experiencing 2 times and above of acid reflux, then we will probably classify you under GERD. Now, acid reflux and heartburn, they are just a symptom. It is not a medical condition. But when it is a GERD, we call it a GERD, then it is considered a medical condition, okay? That means you need medical attention already. This is something serious, okay? Something that can involve some permanent damage if we do not do anything to GERD, okay? GERD, okay, is because we always suffer from some severe heartburn, always, okay? It could happen more than 2 times in a week, okay? When this thing happen, you know, the acid juice is always burning your heart. The acid juice will stay in the stomach, but it comes out and it burns your heart, it burns the esophagus. So it is going to damage the tissue within the esophagus. When this thing happens and it lasts, you know, prolonged exposure to the gastric juice, and then it will create what we call the inflammation. That's why you feel the pain. Whenever you have a pain, no matter it is on your finger or on the heart area, meaning there is an inflammation going on. So when we have this acid reflux that happen too often, so there is not enough time for our body to do self-healing, that means the damage can become permanent. And this is serious, okay? This is considered a serious medical issue, and we call it the GERD, okay? Why we say that going into GERD, you know, from just a normal acid reflux, you know, sometimes you burp something sour, you know, the acid and things. Okay, sometimes, you know, once a while it's all right. But if it happened for a prolonged period of time, if it happened very often, it will lead to permanent damage, we call it. Because once we have this thing, out of 15% of GERD patients, okay, they actually can have cancer after that. You know, this is a very, very high ratio. Yeah, 15% of them actually have a high percentage, because 15% of them actually got this cancer when they have this GERD. Why is that so? Now, what is cancer? Now, a lot of people will keep asking me, Dr. Mary, why I get cancer? You know, I eat well, I sleep well, why I get cancer? Now, basically, there are a lot of reasons, okay, that leads to cancer. But one thing for sure, and everybody agree on it as well, that is prolonged period of inflammation to the body without healing, and then you will see that it will lead to high risk of getting cancer. Yeah, so it's a prolonged chronic inflammation to the particular body, okay, and then it will actually have a high risk of cancer. Now, everybody agree on this thing. It's because whenever before cancer, a lot of people are having inflammation, and this inflammation is a prolonged one. It's a long time, okay? It's a chronic one, and it happened repeatedly. So this is what happened that can lead to very high risk of getting cancer. Yeah. So from acid reflux, if we do not bother about it, it could lead to even heartburn. And then for heartburn, if you don't care, you keep on having heartburn, you have more than twice in a week, okay? And then we could have this GERD coming in. And once we have GERD coming in, there's a high risk of getting cancer. And the damage done by the gastric juice, the stomach juice, it is going to be permanent damage as well. So there are a lot of work to be done. So it can become a medical condition. So always listen to your body all the time. Our body is like a big orchestra, you know, so it's playing. So when you see that the rhythm is not right, you know, the whole song is not right, then you should do something about it rather than just, you know, leave it there. Because when you don't take care of your body, you don't give the right nutrient, you don't give the right environment to the body, it is not going to heal well. Yeah, it's not going to heal. You're not able to initiate your self-healing properties. So we have to go on, be more observant, okay, understand your body, listen to your body condition, and then we try to rectify it before it get worse. So from acid reflux, okay, we can have some heartburn, and then once we have heartburn, you don't just leave it there, because if you don't care about it, it's going to become GERD. Okay, when it becomes GERD, then it's something serious, which I'm going to talk to you on. Now look at this diagram here. We have got two. One is a stomach that is normal. The other one has a stomach that has got acid reflux. You see, the yellow, it's a blue juice here now. Okay, the blue color juice here in the stomach, we call it the gastric juice. Whatever food that comes in, that you put in your mouth, it goes through the esophagus and it comes to the stomach. The stomach will act like a blender. You know, it likes a blender. The gastric juice will break down, you know, a lot of this, because it is very acidic. It's going to break down a lot of this food so that it's easier for digestion later on. So when the food comes here, usually it will go through what we call the pincer. Okay, a pincer, when it goes through, then it shut down. So like I said just now, it act like a valve, it closed up. However, when the blister open, that is where the gastric juice actually flows out. And that is what we call the acid reflux, okay? It flows out. So when it flows out, it can actually burn the esophagus, yeah? It is going to damage the esophagus. And what is worse is that if it goes higher up, then you will feel the sensation of like heart burning, like chest burning. Yeah, that is the thing. So it is like, it is so acidic. Like I mentioned just now, this gastric juice is very acidic. It is so acidic that it can even dissolve the razor blade. You know, the guy used a razor, so it's going to dissolve the razor blade if you soak it there for a prolonged time. Or you put a piece of zinc, you put a piece of this aluminum foil on this acid juice. It can even gastric juice. It can even dissolve it. So when there's acid reflux, it is actually dissolving our own esophagus, you know, so this is going to be permanent damage. That's why we say that when you have an acid reflux, okay, you've got to be really careful, because if it happened very often and you didn't take care of it, it is going to get worse, okay? Now, there are few symptoms of acid reflux. Now, this is where sometimes I will ask that person, I've got chest pain, you know, or I got, you know, maybe I got heart attack, I got a bit of chest pain. Now, chest pain doesn't mean that this must be heart attack, it could be something else. So I will actually ask further. You know, so these are the symptoms of acid reflux, okay? Number one, they could be having the burning sensation, which is very obvious, you know, they have this burning sensation on the throat area, on the chest area. But majority of them may not even up to the throat area yet. Yeah, they will only feel the pain underneath, you know, just slightly above the abdomen, they feel the pain. And then because of the acidic juice, some of them, because it is burning the throat, so some of them even got sore throat. They could be having some very dry cough, okay? It's cough without flame, okay? They could be having some very dry cough as well. And then there will be loss of appetite, and then easily they will feel bloated. And there's very obvious one, they will feel bitterness in the mouth, okay? This is one obvious symptom, because normal heart attack, they don't feel bitterness in the mouth, okay? But if it is acid reflux, okay, even though they feel the chest pain, they feel a bit of heart attack feeling, okay? But then if you ask them, do you feel bitterness in the mouth, okay? So this is also another symptom of acid reflux. Of course, they will experience chest pain. Imagine acidic, okay, being poured over on your chest. Of course, you're going to feel the pain. So some of them will think that, oh, I'm having heart attack, okay, because it is chest pain. Oh no, okay, it could be just acid reflux instead of heart attack. Because if you go, okay, I have one patient, he has been taking this aspirin, okay, he took the aspirin from the doctors, prescribed by the doctors. He took aspirin because he has got heart attack and he went for a stent in the heart. So all the time he's taking aspirin. But after that, he told me that he felt chest pain. Then he was thinking, oh, could it be because of my heart attack? You know, could it be because of my high blood pressure and the heart attack is coming back? Or is it something wrong with the stent that was being placed in there? And then I can feel the chest pain. So in fact, okay, then I will ask the same thing, and I hope that you can ask the same thing as well. I will ask him, okay, do you feel burning sensation? Then sometimes you say yes, sometimes you say no. The next question, which I will ask is, do you recently feel bitterness in the mouth? Whenever you have this chest pain, do you feel bitterness in the mouth? Okay. And most probably he will say yes. And also the swollen gum, okay, and he could have this bad breath also because his digestion is not good because of the acid reflux. So he might even have swollen gum. Then there's bad breath as well, and he could have difficulty in swallowing. So these are some of the symptoms that indicate that he is not having this chest pain because of heart attack. It is more because of acid reflux. And also, a reminder for you, for people taking aspirin, they could experience acid reflux also, because acid reflux, okay, happens when you take aspirin. To certain people, okay, they could experience this thing. This is one of the side effects of aspirin medication. So sometimes for high blood pressure people, you know, those with high heart attack, you know, they always think about chest pain. It may not necessarily be because of the physical chest pain related to high blood pressure. It could actually due to acid reflux also, because they're also taking medication. And there's another very obvious symptom is when they lie down, just like when you're sleeping, you lie flat, then they feel the pain. Why is that so? You imagine your stomach, okay? So when he lie down, that is when, the gastric juice actually flows more. A lot of gastric juice actually flows out because the valve is not closing it. So the valve is not closing up the entrance or the exit. So immediately, once he lie down, the gastric juice actually flows back to the esophagus. That is when he feel even worse. He feel even painful when he lie down. So these are the symptoms of having acid reflux. And then if you always have acid reflux, it's going to burn your heart. That's why they feel heartburn. So prolong all the time having heartburn. Twice it happened, more than twice in a week, then easily you can have this GERD already. In the case of getting GERD, okay, once you have GERD, the doctor will say that, oh, you have GERD already, meaning you have very high level of inflammation. It is going to be painful, okay? And then inflammation at the esophagus, inflammation everywhere because of the gastric juice, it is going to damage our tissue, okay? Once our tissue is damaged, then you feel the pain, okay? And then you will feel a lot, your immunity drop because you probably couldn't even sleep well. It could just start from just little bit, whereby you have acid reflux. If you don't bother about it, it could lead to chest pain, it could lead to damage of the esophagus, it could lead to a lot of inflammation to the body. It is going to affect your immune system, affect your sleep, everything, okay? So everything starts small, okay? All our illness doesn't just happen one day. It starts small, and then if you don't really you don't counterattack your problem, it is going to go to something serious and severe, okay? So this is what I show here to you all, so that you understand that about the symptom of acid reflux. Whenever we have people complaining about chest pain, don't jump into conclusion that, oh, you need Q10, you need to take care of your heart and things. Oh, you got high blood pressure, is it? So these are the things you have to ask further. Yeah, there are some symptoms that actually, if you ask the right question, you can actually understand that this reason may not be chest pain due to high blood pressure or heart attack. It could actually just because of acid reflux. There's inflammation in the body. Whoever having acid reflux, 100% he got inflammation in the body, 100%, okay? Because there will be bound to be some organs like esophagus and things being burned, okay? There will be damaged tissue. Any damaged tissue, during that time, the inflammation will be high, okay? So this is the symptoms of acid reflux. Now, there are reasons, okay? Why do we get acid reflux, okay? A lot of people may ask, hey, how come I have acid reflux? Now, or GERD, or how come I got this chest pain and this thing? Now, few reasons that we can have, and these are all controllable risks, okay? That means risk factor that you can actually, take control of. For example, number one is pregnancy, yeah? Because when we get pregnant, the weight, okay, sometimes the weight and the position of the fetus or the baby, it actually was the baby is heavy, and then it's going to put extra weight, okay, on the stomach, which may result to esophagus, the valve will press open, So sometimes those in pregnancy, the ladies in pregnancy, and then they might experience acid reflux. And of course, after they deliver the baby, usually they will recover, so it's a temporary one. And those who are smoking, okay, the smokers, okay, yes, it's very easy to get acid reflux. And then lack of exercise, okay, very, you don't really move too much, like some office ladies or even some men, okay, not just the ladies, they will sit in the office, or maybe they are bus driver, it takes a lot, or taxi, Grab driver, they don't really walk around. They will just sit there for a long time. So this lack of exercise, lack of movement of the body will also lead to GERD, okay, may also lead to acid reflux. And also, we also have, like, for example, medication I mentioned just now. Medication, for example, antihistamine, antidepressant, and also things like aspirin, okay, something for the heart. All these things can actually lead to acid reflux as well. So if you keep on taking the medication, you will keep on having acid reflux. Sooner or later, it will become heartburn. And then when you keep on having heartburn, then it will become GERD. I have quite a few actually, which is very common among those taking aspirin, those high blood pressure patients who are taking aspirin or who are taking some blood pressure medications. They will actually experience GERD after that. So these are the things, okay? If you are taking a medication and you thought that you are solving your problem, no, it could lead to even more problem, okay? So you have to be very careful. And obesity, okay? People who are obese, overweight, way overweight, okay? They will have this GERD problem as well, okay? Very easy to develop probably because of the food they take in. So some of the things and also some poor diet. Okay, people who are on poor diet, like always on processed food. Now, processed food is something I really especially the processed red meat, which I'm always emphasize on not to take the processed red meat anymore, because processed food and usually they're very high in chemicals like preservatives and colorants and also flavoring, and also they has got very high sodium content, high sugar, high table salt. Now these are the things that actually, what we call poor diet. If you're on poor diet, then it is very easy for us to develop this acid reflux. Yeah. And also those who are taking like a lot of carbonated drinks, okay, carbonated drinks, and also smoking, yeah, some food, okay, hot and spicy food. If you take a lot of spicy food, some of them will actually experience acid reflux. And I know of some people drinking alcohol. They drink a lot, then after that they will go to the toilet and just throw them out again. Yeah, so during this whole process, the acid in your stomach will actually comes out as well. So this is not good. This is going to damage your esophagus also. This will make you feel uncomfortable. So yeah, so these are what we call the controllable risk factors. If you keep on doing this a lot of time, you're going to damage the valve. When the valve or the door, okay, at the esophagus, connecting the esophagus and the stomach, when it get damaged, that is where you will keep on having acid reflux. So this happened to some people who entertain a lot. Maybe they have to drink a lot of, alcohol and things. And then after drinking, then they actually try to vomit those alcohol out again. And this is where we are going to damage the valve that actually separate the esophagus and the stomach. So it's going to damage the valve. So this is what that's why we say that these are all considered what I classify all these things as poor diet. Okay, poor diet, and which will result to all these things. And also caffeine. Okay, caffeine, don't drink too much. Now, I know there are some papers that show that coffee is good for health. It's good for digestive system. It is good for those who have constipation. There are some papers showing that, and sometimes I see these papers, these research papers, they are being subsidized or sponsored by Nestle also. So I don't know how true it is, but let's weigh the consequence of drinking coffee, caffeinated drink. Okay, they are good at that point. But the way I see is that sometimes if our body is not so good already, our body are getting older, it's better not to drink any caffeinated drink. Okay, don't drink any coffee anymore. It's because it can actually create more problem. For example, our acid reflux is one. Okay, acid reflux is going to damage the valve and so on. Yeah, and then and also if you take a large meal, for example, I take a lot of food. I'm hungry, I stay hungry. So there's a lot of acid in the stomach. And then if you stay hungry for a long time, and once you take a lot of food in on you feed on a large meal, you will see that a lot of this gastric juice actually overflow and is going to damage the valve as well. That is where we have the acid reflux. So when you are very hungry, you shouldn't go on large meal. Or some people are not hungry, in fact. They just go on large meal, that's it. Okay, they just prefer to take large meal. I just came back from US. And then I ordered from an Italian restaurant. Now I will just call them as American Italian. I thought because I saw the setting and everything is an Italian restaurant, I ordered pasta. And it appeared that the pasta for me is going to be, no joke, okay, I'm not exaggerating. I think it's meant for 6 person, okay, and it comes as one meal. And I look at the tables around me, people are actually having that big plate by themselves, you know, they're going to eat everything. Now, this large meal will result to a lot of these people, they are going to have this acid reflux. Easily, they will develop acid reflux because the body will need a lot of this stomach juice to digest the lot of food that you're going to put in. So acid reflux will happen if you feed yourself on very large meal, okay? And also, food intolerance. Now, what is food intolerance? Now, we know about food allergy, right? If you're allergic to certain food, usually we will know. For example, I am allergic to pineapple. Once I take pineapple, I have this swollen face. Or I'm allergic to milk. When I drink milk, I get diarrhea. So it happened immediately. This is due to immunoglobulin IgE, whereby if you go to the doctors, you go to clinics, most of the time they're going to do the food allergy test. They will take the immunoglobulin IgE from your blood, the samples, okay, they're going to take it, and then they're going to analyze. Okay, that is what we call the food allergy. Now we have another thing called food intolerance. This is actually a result that you can see by checking your immunoglobulin IgG. Now, I'm not going to dwell into what is IgG, but it is the one of the immune cell that we have. So food intolerance doesn't happen that moment you take the food. It actually happens within 48 hours. That means today I take this food, maybe I can only experience something not able to digest only after 48 hours, okay, which is 2 days later. So food intolerance is also one very obvious reason for getting acid reflux, okay? So sometimes you have to do a food diary of what are the food that you take in every day so that you know that after 1 or 2 days, okay, after 48 hours, if you have some acid reflux, it could be due to food that you took 2 days ago. Now, we can also do the food intolerance test in some hospital, in some lab, but you make sure that you have to ask them to check on the immunoglobulin IgG instead of immunoglobulin IgE. Yeah. So these are the controllable factors. The risk factors are here. Like for example, become obese. Okay. Like if you smoke, if you drink, okay, if you take a lot of spicy food, and then these are the reasons that we get this GERD or acid reflux or heartburn. Okay, we could have all these symptoms if we, these are the contributing factors. Now, there are also certain people who are born this way. Why, Dr. Mary? They are born to get acid reflux? Yes. Okay, that is when the chest area, the structure of the body, when you have a protruding chest, okay, so that is where sometimes because of the protruding chest, that is the structure of some body, it is inherited as well. So sometimes it is very difficult for the valve to close back. So that is because of the structure of the body. But majority of people having acid reflux, it is due to these controllable risk factors, okay? Other than that, once a while, certain people, but the minority, they might have acid reflux. It is because of their bone structure, the chest bone structure. Yeah, that is because of that. Other than that, I think most of the factors can be controlled. And you can see that the diet is one thing, okay? The diet, and that is one very important thing, okay? So if we have this acid reflux already, if you have this thing, now what should we do? Now come back to the controllable risk factors here. Don't always ask me what to eat, okay? When you have a certain chronic disease or certain sign and symptom that is uncomfortable. For example, I always have people asking me, hey, Dr. Mary, I got diabetes, what should I eat? No, I got high blood pressure, what should I eat? I will always tell them, don't think of what to eat first. Think of what not to eat, okay? You shouldn't be eating a lot of things already if you are having some chronic disease. You shouldn't be eating certain food already if you are already experiencing acid reflux, if you're already experiencing GERD, okay? These are the food that you shouldn't be taking. For example, spicy food, don't take it anymore. Very sour food, okay, fruits and that's very sourish, you cannot take them anymore. Take less on the table salt, don't take any processed food. These are all the don't take, yeah. And carbonated drinks, and then don't smoke. Yeah, these are the things you have to avoid. Then we can consider using some supplementation to help our body, yeah. Because if you are still on heavy diet, and then you are still on very heavy food, no, you're not going to recover. So look at this page of these controllable risk factors, and then avoid these risk factors. Then you will see major improvement on your condition. Yeah. So number one, okay, about pregnancy. When you're pregnant, now you can't just go unpregnant suddenly. So it's okay. After your pregnancy, you should recover. So if you're smoking like 5 cigarettes a day, you have to cut down to probably 1 or 2 in order to see improvement. Okay, you have to quit your smoking if possible. And then if you don't exercise, you got to move around, do a bit of exercise. Okay. And if you're taking medication, you have to talk to your doctor already, because the medication that he prescribed for you could have lead to this acid reflux. Well, I have some doctors, once you complain to them on the acid reflux, they probably will just give you some probiotics, or antacids. That's it. They are not giving a lot. Okay, just give you some antacid to control for a while. And then if you're obesity, now it's time to cut down some of the weight. Okay, and also if you are having large meals, okay, in order to feel yourself full again, you probably have to split your meals to more times. Okay, for example, if you're taking 3 meals a day and every meal is huge, you should actually consider to take 5 meals in a day, and every meal cut the portion down. Okay, don't go on such big portion. And also, if you have food intolerance, where I told you to actually do a quick food diary, if you didn't do a good food diary as well, you can actually run for the test. Yeah, it's okay to go for the test, but I think the test could be quite costly. If you want to save the money, you can actually do a food diary yourself, and then cut down all those processed food, processed meat, hot dogs, bacon, and all that, especially the red meat. You have to cut them down, and canned food as well. Cut down on the sodium, the salt and things, and increase your dietary fiber. That is, you have, meaning, simple words, you have to take more greens. Okay, you have to take more vegetables. For those who are having this acid reflux, most of the time it is because you don't take enough fiber, so you have to increase on that one as well. And now that you have done all these factors, you are trying to avoid all these factors already, then I will suggest you to go for some supplementation as well, because it's going to improve a lot. You're going to see tremendous improvement when we start on supplementation. Now, moving to the next page, we have some supplementation that really works on those with GERD. Okay, number one, we have Revive there. Okay, Revive is for those who have got this inflammation. Like I said, acid reflux, there's always this inflammation. Now, Revive can actually help to reduce the inflammation. Now, I put out that one is the main contributing why we are using Revive. Okay, because Revive, we've got this ginger, the turmeric, the curcumin, and we have got resveratrol in Revive, and we also have some a lot of these antioxidants that can actually reduce the inflammation in the body. So whenever we have this acid reflux, and then you have got heartburn and you have got pain in the chest, the number one thing we do to reduce the symptoms is by reducing the inflammation in the body. And Revive will actually work very well on that one. So you can take on Revive. And of course, we need to maintain a good floral condition on your bowel. So that is where we will need a very good probiotics. Now, I have got these probiotics here. So this can actually help to maintain a very healthy digestion. And also, our probiotic, it is very strong, because when we choose probiotic, you look at how many strains of probiotic in there. Ours has got 9 strains. So it actually works for almost everybody. And of course, it has got very active bacteria in there. So when the bacteria are not active, you probably can't see good result. But ours is super active. I think I sent out some videos today on how to make the yogurt using our probiotics, and you can see that this is amazing. It shows that our probiotic is very active. That is why you can see that it becomes yogurt overnight without even going to, if you add probiotics to our milk, just a small cup of milk, it can actually turn to become yogurt. Yeah, it is because our bacteria are very active. This is one of the very good reasons. And we need to put in probiotic to our body so that the digestive system is back on track again. Yeah, because when you have acid reflux, you can see that a lot of our bacteria, they will not be on a balanced condition. So bad bacteria will come out because of the inflammation in the bowel. So this, if we have the tribiotics with us, which is the probiotics, then it can actually help a lot. And we also need to have NMN Plus, because NMN Plus actually helps to repair the damaged tissue. Okay, it helps a lot to repair the damaged tissue using our protein plus NMN. Okay, these two ingredients, when they work together, it really helps to repair the damaged tissue and to repair the damaged valve. Okay, when the valve is not being repaired, you will see that you always have this acid reflux. So we need to include this protein in there to repair the damaged tissue. So a combination of these 4 products, okay, number 1, reduce the pain, reduce the inflammation in the body, but you haven't repaired the tissue yet. And we need protein and NMN Plus that work together to repair the valve, to repair the tissue. And also for people who are getting older and older, as we mature, what you see is your age, okay, that you matured. Actually, our organs also getting older. Our organs will mature as well. That is why we put in protein and NMN. NMN actually is an anti-aging supplement. So it helps to reverse aging as well, so that our organs are reactivated. So we have protein plus the NMN together. So they works, okay, to repair the damaged tissue that happens at the esophagus, that happens to the valves, okay? And the tribiotics is there to maintain a good floral condition in your bowel. So these are the supplementation that we always recommend for those people having this GERD. Now we have few testimonials of people taking our products and they see improvements. Now, just like I already mentioned to you, number 1, when we have people approaching us for assistance, they could be complaining some of the signs and symptoms. You got to ask the right question so that you know what is the reason, okay, of having this before we provide a solution. So for acid reflux, for heartburn, there are certain signs and symptoms that actually leads you to understand, to differentiate the symptoms, okay, from getting like chest pain is because of heart attack. It may not be because of that. It could be because of just this acid reflux, because of heartburn, because of this GERD. And then second thing, once you identify that this is due to the digestive system, then we will need to know what are the reason of this person getting this. So you have to ask certain questions like, did you go on huge meal? Did you take a lot of processed food and red meat and things? And then do you smoke and things? Okay, so these are the things we'll ask them. And then once we get once we know the reason of him getting this kind of symptoms, we will suggest them certain food and certain lifestyle that he should adopt. Okay. After that, we'll suggest them to take on supplementation. Now, to add on, other than supplementation on the food, for those already having this problem with acid reflux, now I will suggest that you will take extra. Okay, one more thing. Before you take on any meal, before you eat, okay, you can actually get some apple cider vinegar. Okay, put a bit of honey, drink it first, then only you go and have your meal. Yeah, so this is one way to help the body, to help the gastric juice to digest well as well, to help the food to be digested easily. So we will actually also suggest apple cider vinegar plus honey. You don't just drink it neat because it's going to be very sour as well. It doesn't taste good. So usually I will ask them to put a little bit of honey, and honey actually helps to repair our valve as well. It helps to build back the lining, the membrane in our gastric. So it helps, okay? So you just put in a little bit. So this is also one way. So actually, we always say that food heals. Yeah, your food is your medicine. Your food can heal on the condition that you give it enough time. You give it enough. There's sufficient portion of it. Okay, it is sufficient amount, enough time, sufficient amount, and give it the right thing to do. Yeah, the right food. Then your body can actually heal. You have to give your body, expose your body to the right environment. So when we are having acid reflux already and you still want to go for your curry and your spicy food, you're not going to recover. You have to take all those things away and then keep it to simple food, more vegetables, okay, more vegetables for yourself, high fiber, and then take in more greens and then remove all those processed food in the diet. And then you will see tremendous improvement. Yeah. So all the time when we have chronic disease, we always, number one, ask the right question, identify the root of the problem, and then we give solution. The solution always comes with lifestyle change, diet change, and supplementation. Because when this person is sick already, by just having a normal meal is not going to help. That's why we need to bring in additional things, supplementation, yeah, so that you can see a quick result. It's just that when you are not feeling well already, you can't be feeling like just a normal person. That's why we need additional add-on like supplementation for them to see a big difference. Yeah, so these are the three things we always suggest for people if they're having some chronic conditions such as heartburn, such as GERD. Okay, so I think that's all for my for my sharing today. And then I hope that this helps you. And then I also hope that if you're having GERD as well, you can also share this with me, how you actually recover using our product, because I know I have some testimonials. They have this GERD and he actually recovered so well. And he used to be sleeping, because I told you he couldn't be lying flat when you are having GERD, because the acid is going to pass through the valve and enter the esophagus. So he has to like sleep like 45 degree. He couldn't lie flat for 10 years, 20 years. He was having this. And after our consultation, and then he has already recovered from a condition like this. Yeah, so yeah, there are a lot of testimonials. And then if you have experienced things like this, you're having this condition as well, I think give it a try. You could probably see improvement within a month. Okay, within a month. So this is how we can be very sure of. Okay, right, that's all for my sharing today. And then I'm going to look for some, if you have some questions on the floor, I'll just reply from there. I'll pass the time to Samantha. Thank you, Samantha, and thank you,
Thank you,
everyone.
Dr. Mary. So there's one comment about eating too much of apple and experience acid reflux.
Yeah, it is because like I say, you might have food intolerance towards apple. Apple is something very common, but listen here, except for salt and water, anyone, okay, it could be intolerant to anything. I have patients who are intolerant to rice. Rice is so common, we eat rice from young, you see, and then he's intolerant to rice even. So anything can have this food intolerance. So if you realize that you take apple and you're going to have acid reflux after that, so probably you have to avoid taking apple. Yeah, it's because everybody's, the body is different, we react differently. So even like rice, yeah. So let's be cautious on the food that we take. Now, if you always have this acid reflux, I always suggest them to take a food diary. Now, how do you do a food library? Food diary, sorry, food library, food diary. So it's like Monday, you just write down what is your breakfast, your lunch, your dinner, whatever food that you take in, you just write it down, and then you observe, okay, which day, okay, for example, on Wednesday, I have this acid reflux. Then you have to move back 2 days ago. What are the food that you've taken? And these are the food that could have resulted to this acid reflux. Yeah.
Okay, there is another question about pregnant lady can take NNM and revive.
Yeah, of course you can take that. Okay. Okay. If for pregnant lady, you can take NMN, no problem. Okay, and then it is good also for the baby. It's good for the fetus as well, because it's a very good ingredient to connect a lot of nerves. Now, should we take Revive? Now, Revive, we have got this turmeric in there. So And then, but our sachet is only 3 milliliter, which is very little. So if you are pregnant, and then we could have inflammation in the body as well. Sometimes even pregnant ladies can get sore throat. Pregnant ladies can have fever also. So we can take Revive to avoid all this because it acts anti-inflammatory properties. So it will actually helps even for a pregnant lady. However, I don't suggest you to take a lot in a sense whereby you take 10 sachet, equivalent to 30 ml a day. I don't suggest you to take that because that amount is the amount of 30 ml of very concentrated curcumin. It can contract the uterus, so that is a bit high already. So I just says you can take like 2 sachet. It's okay to take in a day. 2 to 4 sachet, no problem, but don't take up to 10 and above. Then there will be a little bit of risk there. So I would suggest pregnant lady to take in huge amount. But NMN, no problem. Just Revive because we have got curcumin in there. So don't take more than 10 sachet, which is equivalent to 30 ml a day. No, okay? For our product, because we've got this LNDT technology that ensure the absorption. So you don't have to take so many, you see. So you can just take 2 to 4 sachet when you are, if that pregnant lady is having inflammation, he will take up to 4. But just for normal maintenance, take 1 will do, you see, because our product is very potent, okay?
Okay, when is the good time to consume Revive and when for NNM tribiotics can take all at the same time?
Yes, you can take everything at the same time. And then for those who have already got gastric problem, acid reflux, I suggest you take after meal or during meal, meaning you are taking your rice, then halfway through, you can take the product, then continue with your meal. Yeah, so either you take it after meal, right after meal, don't wait, or you take it during meal. Yeah, this is especially so for those already having digestive problem or gastric problem, gastric ulcer, or acid reflux. Then I would suggest you to take after meal. But before or after meal, the absorption is the same. Okay. Our product, okay, it still works well, so it's okay. But for those who are not having a good digestive system, who are having gastric problem already, who are having ulcer in the stomach, then I'll suggest that you can take after meal. Okay, what is the maximum dose for Revive, okay, with chronic inflammation? Well, if it's just chronic inflammation, for now, basically, we don't have any papers on upper limit. That is what you mentioned as the maximum dose. There is, basically, for now, there's none that shows. Is because the Revive, the product is actually from turmeric, from ginger, and all this food. So it has been extracted to get from turmeric, we get the curcumin. So imagine you at home, we take a lot of ginger and all that. You take 1 kg of ginger, blend it. If you take the ginger, you don't have that much of problem in the day. So for now, I don't see any upper limit for taking turmeric, for taking ginger and things, yeah, or grapes, resveratrol, and so on. So it's okay. But for me, looking at our product and the experience we have with the product for the past 3 years, I think if it is chronic inflammation during that time, you can take up to 6 to 10 sachet in a day. And then usually your body will tell you, you don't feel so painful anymore. It is less swollen now. Then you can reduce it. So like I used to have one like Mark. I would ask him to take almost like 10 sachet in a day, 30 ml a day. Yeah. So he's taking that in order to reduce the chronic inflammation on his liver and then he will see very good improvement. But after 1 month, then it is back to just 3 ml a day. Yeah, so if you are going on a high dosage, which I don't suggest you to take forever on a high dosage, you can actually hit on high dosage for 1 week. And then if you see that you have already improved well, then you can reduce it. You don't have to take it all the time on high dosage. Yeah, we need revive for reflux is because acid reflux always comes with inflammation. Yeah, always. So we need to have revive to reduce the pain, to reduce the inflammation in the body. Yeah, and also why they have the pain is because there's a damaged tissue due to the very acidic stomach juice. So that's why we try to heal back. Now listen to this: your body cannot heal, your body cannot repair when you have inflammation. So you need to come up with the inflammation properties, okay, get it done, then the body can heal very fast. How can your body heal when there's an inflammation, right? So we need to, get the inflammation, anti-inflammation properties in, then you can see that it actually helps. Okay, ginger can stimulate stomach acid. That's why take it after meal. Yeah, all our supplementation, you can take it after meal. Ginger actually is an anti-inflammation product as well, and then it helps. Yeah. Yeah, you can go as high to 10 sachet, but don't take it every day for 10 sachet for 1 year, Yeah, it's going to hurt your wallet. But then most importantly is that for me, I would suggest to take on very high dose for a long period of time when your body is already, it is in good condition, is optimum. You don't have to do that. We just need something to protect ourselves for the antioxidant effects. Usually we take 1 or 2 sachet in a day, unless we have inflammation now. And this is acute one. Then and a serious one, and then probably we take like 6 to 10. But then normal under you're not that bad yet. Usually you just take 4 to 6 for chronic condition. It works very well already. Yeah. Remember, our product has got LNDT technology, so the absorption is very high. It's unlike other brands or other products in the market, whereby they always encourage you to take a lot because the absorption is low. That's why you have to take too much. But for us here, the way I see, based on experience for the past 3 years, I see people recovering so well, even though they're taking 1 to 4 sachet. You see, it depends on body. So listen to your body, listen to the orchestra the body plays, and then you can actually, do the adjustment from there.
If a cancer patient having acid reflux, is it because of the chemo drugs?
Yes. Okay. Once they do chemo, okay, once they have chemo, the membrane, the lining, okay, they will all be damaged. So easily, the valve that is actually separating the esophagus and the stomach acid juice, it will be damaged. So easily they will have acid reflux. Yeah. So this is one of the very common side effects from chemo. So I think the doctors will also advise them the same way as well. That is why they will even vomit after taking food. Yeah, they will vomit straight away. It's because all the linings are been damaged already. Yeah. So even along the esophagus, everything. Or when it get even worse, okay, maybe on the 5th times of chemo, you will see that even they got mouth ulcer, okay, ulcer in the mouth everywhere. It is the same thing is going to happen to the esophagus in there as well. It's going to happen everywhere internally. So they couldn't eat well, they're going to lose their appetite, and they're going to complain to you, they have bitterness in the mouth. Yeah, all these things that I put down just now, cancer patient, after doing the chemo, they probably will also experience this. So what we help them out is that if they are, I mean, it's a little bit out of topic, but it's all right. If they are already having the chemo and they have this ulcer in the mouth, I will suggest them to take ice cream, okay? Because that is the time where that is probably the food that they can take. So when they take ice cream, I will actually, we can make our own ice cream, put in high protein powder, and then mix it with milk, and then just freeze it, and then they can take our product. Otherwise, they couldn't drink, they couldn't eat. So usually we will just put everything, blend it, and then very thick, and then put it in the fridge, freeze it, and then let them eat again, and then they can actually eat in. Otherwise, they couldn't eat at all. Yeah, even the soup I have to freeze it so that they can eat. Yeah.
I think all the questions from the floor, that is all.
Okay, yes, stress can cause acid reflux as well. That is because we have this thing called the gut-brain axis. Yeah, so I'm not going to talk too much about gut-brain axis today, but because of gut-brain axis, your emotion, yeah, it is going to affect your digestive system as well. It's going to affect your gastric juice as well. So yeah, control on your emotion because gut-brain axis we have got there. Yeah. So yeah, that's all.
That's
Yeah,
all.
I'm so glad you are very, you are all participating in it. And yeah, next time I should leave some extra time so that we can actually, yeah, converse more.
Okay. Thank you very much, Dr. Mary. So all the sharings from Dr. Mary is about the dangers of the heartburn and acid reflux. With the potential complications, we should be more vigilant about our digestive health and how nutrition could lift us from the alarming health, and listen to our body, like how Dr. Mary says, our body plays orchestra. So pay attention to your body sounds and music they play, okay? So look at the symptom. If there are persistent symptom, right, shouldn't be ignored. Always take down some food diary if you could, to adapt a healthier lifestyle. Be mindful on your dietary habits. Like Dr. Mary shared about food taking. Be more mindful on the food that you are taking, especially red meat, processed red meats. Supplementations are paramount and safeguard our long-term consequences of our body as well, away from those conditions. Yeah. So let's empower ourselves with the knowledge that we have learned tonight and prioritize our well-being. So do the people around us. So thank you very much again, Dr. Mary, for this eye-open session. And we carry all the knowledge to take care of people around us. Like the quote says, a healthy gut is the gateway to the healthy body and mind. Okay, so everybody, thank you very much for participating today's health talk section. So next thing, just a quick one.